Hi everyone, it is Dr. Joyce Park, board certified dermatologist. Welcome back to my channel. I had posted my reaction to Sydney Sweeney's skincare routine a couple weeks ago, and I was flooded with questions and comments about Milia because I had commented that Sydney Sweeney uses Vaseline and she practices slugging around her eye area, and I said that that is a no-no if you're prone to developing Milia. So I wanted to address all of these comments and questions today. Let's get right into it. What is Milia? What causes it? And what can we do about it? First of all, what are milia, or singular milium? Milia are basically dermal cysts that represent keratin that is trapped underneath the top surface of the skin. This can occur in many different places on the body, but most commonly they can form around the eyes, around the nose, around the chin, pretty much anywhere on the face, but they can also form on your upper body, your torso, your chest area, and even in the groin region as well. Now, why does this happen in the first place? Like, why does keratin get trapped beneath the surface of our skin? Well, it turns out that it takes anywhere from 28 to 40 plus days for our skin cells to renew, meaning our cells work their way from being at the bottom of the epidermis all the way to the topmost layer, the stratum corneum, where then they're ultimately shed. When we're babies, our skin renewal rate is very, very fast, somewhere around 14 days. Then in your 20s, it lengthens and it can take up to around 28 days. Then in your 30s and 40s and 50s and 60s, that process only gets longer and longer, taking over a month or even a month and a half for those skin cells to get shed. So as it takes longer for your cells to work their way up and get shed and exfoliated, then there's a higher chance that that keratin protein is going to get retained for whatever reason, whether it's because your skin just has a difficult time turning over and shedding, or whether you're using occlusive products on top of it that prevent that shedding, or because you're getting a lot of sun exposure, which changes the texture of your skin and causes more difficulty in shedding that dead skin. So as that keratin protein, which is the basic building block of skin, as that keratin's trapped underneath the top layer of your skin, it forms this white bump. Now, some people may think that this white bump looks just like a whitehead, and sometimes it can look similar. They're both white bumps that are slightly shiny. However, milia have a more pearly consistency and it's more firm. A whitehead is filled with pus. If we extract a whitehead, this gooey, liquidy pus substance comes out. Whereas milia, if we extract a milia, this actual pearly, firm, solid substance is removed. So the actual makeup of whiteheads versus milia are very different, and the structures that are inside of them are different as well. And unlike whiteheads, which can be popped at home, unfortunately sometimes, milia cannot be removed at home. You are not going to be able to squeeze them out without causing significant damage to your skin, which I highly recommend against. Another cause of milia is actually trauma. So I have seen this happen in my patients with blistering diseases such as bullous pemphigoid or pemphigus vulgaris. As the skin forms blisters and then is traumatized, the barrier is broken and then it heals again, milia can form as a part of that process. So if you've ever gotten burned, like literally burned, either from the sun or from cooking or whatever, and your skin sustained significant injury, there is a chance that you may form milia in the skin that heals after that traumatic injury. Now, the most common question I got on my social media with regards to milia is how to prevent them and how to treat them. So let's tackle prevention first, because prevention is always key, right? And it does take a very consistent and true dedication to skincare in order to prevent anything, whether it's milia, sun damage, aging, skin cancers, whatever, you name it. Prevention of milia is no different. So when we talk about, just the basic building blocks of a good skincare regimen, I always think cleanse, moisturize, antioxidant, SPF. In the morning, I always recommend you use some type of antioxidant, whether that's vitamin C, vitamin E, niacinamide. That will help prevent that sun damage. You always want to pair that with a really great sunscreen. I'm going to link a few of my favorite sunscreens in the caption below because I always get asked what my favorite sunscreens are. The reason why this is important in the context of milia is that we know that milia is more likely to form in sun damaged skin. And that's not even just because you get sunburned, like how I talked about how milia forms during trauma. No, this is different. Over time, if you have a lot of exposure to the sun, those UV rays will actually cause a change in the texture of your skin, where your pores get larger, you lose collagen, you lose elastin, you lose basically all the structures in your skin that keep it nice and uptight. Everything starts to fall and sag. The texture part is what I want to hone in on. as your skin texture worsens, your chances of developing milia goes up. And so protecting your skin from the sun is great for many reasons, but in the context of milia, protecting your skin from UV rays actually helps to prevent milia formation over time. Also, in terms of prevention, which can also double as treatment, you want to think about things you can do at home in terms of products that you can use to target milia. I always recommend using some type of exfoliant. I prefer chemical exfoliants like AHAs or BHAs over physical ones, which are like seeds, walnut shells, etc. And the reason why I prefer chemical exfoliants is because they're a little bit more elegant and they're less likely to cause damage or micro tears to your skin, especially if you have sensitive skin. So AHAs consist of lactic acid, glycolic acid, just to name a few. BHAs consist of things like salicylic acid, which is more oil soluble and able to penetrate deeper into the pores, great for those with oily skin. Those exfoliants are all great to use a couple times a week for your skin to help you exfoliate and also prevent and treat milia. The other category of skincare products that you can consider using both to prevent and treat milia are retinoids and retinols. I've talked a lot about these before, but they're basically vitamin A derivatives that are converted to retinoic acid in the skin. Over time, they can help improve skin texture, they can improve collagen synthesis, they can help with dark spots, and they can also help normalize your skin cell turnover so that can help prevent and treat milia. You know, the under eye area and the around the eye area, we call this the periorbital region. That skin is very sensitive, very thin, very prone to irritation. And so if you're not able to handle a retinoid there, I would recommend looking into a retinol. There is one eye cream that I do really like. It is by SkinBetter and it is the EyeMax AlphaRet Overnight Eye Cream. The reason why I like it so much is because it's actually a retinoid that's conjugated with an AHA called lactic acid. And so it kind of has a dual purpose in that it has two super strong powerhouse ingredients. However, it has been clinically tested and proven to be safe to use around the eye area and also very effective. So that's one that I think checks all the boxes and has really great ingredients. Another retinol eye product that I really like is the Rock Correction Retinol Eye Cream. And I think that one is light enough that you can use it around the eye area and not predispose you to developing more milia. Now, aside from products, because if you've already tried the products and it's just not working to get rid of your milia, what else can we do? What's the next step? Definitely go in and pay your neighborhood dermatologist a little visit because we have a lot of tricks up our sleeve and a lot of things we can do to help you get rid of that milia. So in the past, what I have often used is the de-roofing technique. We also call this acne surgery in the clinic. Basically what I'll do is I will use a sterile needle to unroof the top of the milia and then use either two cotton-tipped applicators, which is a fancy term for Q-tips, or a comedone extractor and just pop that little milia pearl right out. Another method that people can use is called electrodesiccation, where we basically use cautery on a very, very low setting to gently burn the top surface of that milia and cause a little scab, which will dry up and then fall off after a week. Another similar concept is using liquid nitrogen or cryotherapy, which when delivered in small, short bursts to the skin can cause almost like a freezer burn. We can cause limited and controlled damage to that area of your skin in order to cause a scab, which will again fall off after about a week, thereby getting rid of the milia. Some people can also use laser therapy. That one is more advanced, and I would suggest definitely getting to know who is going to be doing the laser on you before you go ahead and do it. That wouldn't be my first option for removing milia, especially if you only have 1 or 2 milia. Then the other techniques that I mentioned are very targeted and can be very, very effective. One of the reasons I think milia has come back into the spotlight, or at least people are more familiar with it, is because of slugging. So slugging is this viral trend that has resurfaced on TikTok despite it being very popular in the 80s and 90s, where patients basically apply Vaseline or some other very occlusive petrolatum-based product, Vaseline, Aquaphor, all over their face in order to basically trap in moisture. I definitely think Vaseline or Aquaphor are great options for people with really, really dry skin, but I want to caution you that you only want to use it in select areas of the face. So I like using it on the lips, around the eyebrow area, if that's particularly dry, around the ear area, the chin area. However, I do not recommend it for right around the eyes because it is very occlusive and it does predispose you to developing milia. So if you already have milia, or if you know you have kind of oily skin and you're prone to getting your pores clogged, I would not not choose slugging. Milia are not dangerous, and you don't necessarily have to get them treated or removed. It's more of a cosmetic concern. So when patients come to me and they say, you know, this little white bump is really bothering me, it's affecting my appearance and my self-confidence, I'm happy to remove it for them. It's a simple procedure in office, usually does not leave a scar. So I hope this video was helpful in explaining what milia are, why do you get them, how to prevent them, how to treat them, what not to do. And if you have any questions, of course, feel free to leave them below and I would love to answer them. As always, don't forget to subscribe and also let me know what other topics you want me to discuss. Until next time, bye!